All right, let's talk about a specific type of eye surgery called a vitrectomy. Now, I know that word might sound a little intense, right? But the whole point here is to break it down so it's simple, clear, and hopefully a lot less scary. So let's dive in.
So, to get us started, let me ask you something. Have you ever heard eye surgery described as cleaning a snow globe? It sounds kind of weird, I know, but it's actually the perfect way to think about what a vitrectomy does. And that snow globe idea, it really nails it. See, a vitrectomy is a procedure where a surgeon removes the vitreous. That's the jelly-like stuff that fills up the middle of your eye. When that jelly gets cloudy with blood or debris, it's exactly like trying to see through a murky, shaken-up snow globe. So the surgeon simply cleans it out, fixes any issues on the retina at the back, and then refills the eye with a clear solution or a special bubble to help it heal.
Okay, so that brings up the big question. Why would someone even need this surgery in the first place? Well, it all boils down to restoring your vision when something's either blocking the light or damaging the back of the eye.
The reasons really fall into three main buckets. First, to clear things up so you can see. Second, to get in there and fix the retina itself. And third, to remove any foreign objects that shouldn't be there. Let's break down what each of those actually means.
First up, clearing things up. This one is all about getting a clear view. If you have a condition like a diabetic vitreous hemorrhage, it can cause bleeding inside the eye. Suddenly, that clear jelly's all cloudy, and light can't get to the retina properly. A vitrectomy basically just clears that path, letting you see again.
The second reason is a bit more structural. Sometimes the problem isn't just that the jelly is cloudy. The jelly itself can start pulling on the retina. And the retina, that's the super important light-sensing layer at the very back of your eye. If it gets pulled on, it can detach, or you can get scar tissue that creates wrinkles, which they call a macular pucker or a hole. So by taking out the vitreous, the surgeon gets a clear shot to go in and make those really critical repairs. And finally, the procedure is also used for trauma. If an injury leaves some debris or a foreign object inside your eye, a vitrectomy is the safest way for a surgeon to go in and carefully take it out, which helps prevent any more damage or infection. Okay, so that's the why of the surgery. Now let's switch gears and talk about what comes next. Recovery. Look, it's totally normal to have some discomfort afterward, but the good news is it's very manageable.
Your doctor's going to give you a solid game plan, and it'll probably include a few key things. You'll have prescribed eye drops to handle infection and inflammation, along with some approved pain relievers. A simple cold compress can work wonders for swelling. And this one's huge. You have to wear your protective eye shield, especially at night to prevent any accidental bumps while you sleep. And most of all, just rest. Let your body do its thing and heal.
Now listen up, because this is incredibly important. A little scratchiness or a dull ache is normal, but severe throbbing pain or a really bad headache, that is not normal. That can be a sign that the pressure inside your eye is way too high, and that's an emergency. You need to contact your surgeon immediately if you feel that. Don't wait.
All right, now we have to talk about what is, for many people, the absolute hardest part of recovery. It's the required head positioning, or posturing, as they call it. And this is where the real mental and physical challenge kicks in. We're not talking about an hour or two. Depending on your surgery, you could be required to keep this face-down position for anywhere from 1 to 3 weeks. Yeah, you heard me right. It's a major commitment, so it's vital to be prepared for it. So why on earth do you have to do this? Well, if your surgeon puts a gas or oil bubble in your eye, think of it like a temporary internal bandage. It holds the retina in place while it heals. But for that bubble to work, gravity needs to push it up against the right spot on your retina. The only way to do that is by keeping your head face down. This is, without a doubt, the single most critical thing that you control for a successful outcome. The trade-off, of course, is that this can cause some very real neck and back pain. And speaking of that gas bubble, here is a non-negotiable critical warning. You absolutely cannot fly in an airplane. Changes in cabin pressure at altitude will cause that gas bubble to expand, which can lead to a massive spike in eye pressure and cause severe, permanent damage. No flying until your doctor gives you the all clear. Period.
The good news is you don't have to go through this posturing period without help. There are a bunch of tools and strategies that can make it much, much more manageable. Sleep is often the biggest worry. A simple but effective trick is using a travel pillow on your forehead to give yourself some space to breathe while lying face down. For more support, you can also rent or buy specialized systems that are basically cushions with a face opening, kind of like a massage table.
And staying occupied during the day is just as important. There's a whole range of equipment designed for this. Face-down cradles let you sit at a table so you can still read or use a tablet. A massage table can be a comfortable option for resting. And I have to mention the prismatic mirrors. These things are a fantastic invention that lets you watch TV or see what's in front of you, all while keeping your head down. They can be a real lifesaver for beating boredom.
And don't forget the simple things. As long as your doctor approves, try to vary your position slightly between sitting and lying down to avoid getting too stiff. Also, ask your doctor about some simple, gentle neck and shoulder stretches you can do to relieve some of that strain. So after exploring all of this, what's the single most important rule? It's simple. Listen to your surgeon's team. They know your specific case, and their instructions are your roadmap to success. While all these tools and tips can help, following their advice precisely is the most powerful thing you can do. Remember, this recovery is a partnership, and by being an active, informed patient, you are taking the most important step toward healing and seeing your world clearly again.